Hi there, I'm Amy, and this is Hospice 101. Today we're answering a question that matters deeply to families considering hospice. When you choose hospice care, when you decide to focus on comfort instead of continuing with standard treatments that don't seem to be helping, what can a hospice team offer that your familiar medical team can't? Hospice teams aren't just providing the same care in a different location. They're specially trained experts who approach pain and symptom management in ways that are often much more effective than standard hospital care. And when pain and difficult symptoms are better controlled, families tell us something remarkable happens. Patients can actually feel more like themselves again, instead of being defined by their pain and illness. There's space for calm, for clarity, and for simply being, rather than constantly fighting through crisis after crisis. And that creates room for what matters most: meaningful time with loved ones, yes, but also a sense of peace and dignity in how you live each day. So let me explain what makes hospice pain management different, and why it often works when other approaches don't. Let's start with who provides hospice care. Hospice doctors and nurses are specialists who have received extensive additional training specifically in pain management and comfort care at the end of life. Hospice nurses complete hundreds of hours of specialized training focused on symptom control and pain assessment. Hospice doctors complete fellowship training in advanced pain management techniques. What this means is, your hospice team has spent years learning how to help people feel comfortable and at peace, rather than overwhelmed by symptoms. That's their medical expertise. That's what they do. Now let me explain how hospice manages pain differently. In typical hospital settings, pain medication is often given on an as-needed basis. You wait until the pain gets bad, you ask for medication, and then you wait for it to take effect. That cycle can leave people feeling like their whole day revolves around managing pain. Hospice works proactively instead. Medications are given on a regular schedule to prevent pain from building up. Plus, you have fast-acting medication right at your bedside for breakthrough pain. And hospice nurses can adjust medications quickly, sometimes within hours, based on how you're feeling right now. No waiting for days for approvals. The goal is to help you feel comfortable enough to actually live, not just survive from one painful moment to another. Next, I want to address concerns about medications like morphine or other opioids. When someone has a life-limiting illness and is suffering, comfort becomes the top priority. Research shows that when pain medications are properly managed, addiction is extremely rare. And hospice teams are experts at finding the right balance. Enough medication to control pain, while keeping people alert enough to be present and feel more like themselves. Studies show that 80% of families report their loved one received just the right amount of pain medication in hospice. That's because hospice individualizes the approach for each person's needs. Another crucial difference is 24-hour, 7-day availability. Pain doesn't wait for business hours, and neither does hospice. At any time, day or night, you can call and reach an experienced hospice nurse who knows your situation and can help right then. If pain suddenly gets worse at 2 a.m, the hospice nurse can walk you through safely using your medication, or if needed, the nurse can come to you. This continuous support means families never feel alone when symptoms arise. Here's something else you need to know. Hospice teams think about pain more broadly. They call this total pain. It's the understanding that physical symptoms, emotional distress, and spiritual concerns are all intertwined. Take breathing difficulties, for example. Yes, it's a physical symptom, but it also comes with intense anxiety and fear that make the suffering worse. The same is true for restlessness or spiritual concerns about what's happening. All of these can make it impossible to feel at peace. Hospice teams specialize in managing all of these dimensions. For emotional and spiritual distress, The hospice team includes social workers who provide psychological support and counseling, and chaplains who offer spiritual care and comfort. This is what we mean by treating the whole person. Because feeling like yourself again means addressing whatever is causing suffering: the physical symptoms, the emotional impact, and the deeper questions about meaning and peace. So does this specialized approach actually make a difference? The research is very clear. Studies involving thousands of patients show that hospice care significantly improves quality of life and reduces suffering. 70% of hospice patients show improvement in pain levels or remain pain-free throughout their care. And families consistently report much higher satisfaction with hospice care, particularly when it comes to pain control and feeling supported. Now, before continuing, I want to acknowledge something really important. We're talking about pain management at the end of life. And I know that's difficult to think about. But here's what hospice care really offers: the knowledge that if you or someone you love is facing a life-limiting illness, there are experts who can help manage pain and difficult symptoms. You don't have to be consumed by suffering. Hospice teams have the training, the tools, and the commitment to help people feel more like themselves again. So whatever time you have can be about connection and peace, not just enduring crisis after crisis. If you have questions about how hospice manages pain and symptoms, or want to understand what hospice care could look like for your situation, please reach out to us at Everlight Hospice. We'll give you honest information about how we approach comfort care, with no pressure and no judgment. Because everyone deserves to understand their choices.